Hello everyone. So today we are going to discuss about the normal chest X-ray and what structures one should look out for while interpreting the normal chest X-ray. And this will be our sample for today. So the first thing one should do while holding a chest X-ray in your hands is that you should determine the lungs, which one is the right lung and which one is the left lung. So usually we can do it by the presence of heart, but in some pathologies the heart can be present on right side as well. So always look out for the capital L, which will be written on the top. So the side towards the L is obviously the left lung and the other side is the right lung. After determining the lungs, we should look out for the trachea, which will be corresponding to the processus spinosus. After that, the trachea, below it is present on the left side the aortic arc or the aortic knob. Now, after determining these structures, we should determine the shape of the ribs. Like in this case, the ribs are like in the normal shape, but sometimes the ribs can be parallel as well. If the ribs are parallel, it may suggest us some problems about ventilation. After determining this, we must look out for the side of heart. Now, after doing this, we must determine the two angles which should be present in the normal chest X-ray, and the two angles are the costophrenic angle, which I'll be showing you in red color, and the other angle is cardiophrenic angle. So the first one is costophrenic, and the second is cardiophrenic angle. So after determining both the angles, we should look for the shadow of hilum on both the sides, and this part which I am encircling in the red corresponds to the hilar points on the left lung and the right lung. Okay, after doing this, we should look for the abdominal organs as well. So on the right side, as we know that there is the presence of liver, and the normal boundaries of liver will be like this. Besides liver, on the left side there will be spleen, and between the spleen and the liver, the small bubble which we are looking at is the bubble of stomach. Okay, so now I want you guys to pause the video for a second and try to memorize all the structures which we have studied till now. Now these are all the basic structures which you should determine while you are holding the chest X-ray uh, at the first. Now after this, let us try to discuss few more structures in detail. For that I am going to erase this data. Also you should determine the number of ribs. So first of all, let us determine the number of posterior ribs, which should be 10 in number when looking at the chest X-ray. So first, second, third, fourth, fifth, sixth, seventh, eighth, ninth, and the 10th rib. Also note that about the anterior ribs, we will be only able to see 9 of them because of the presence of diaphragm. Now at the top, the small shapes which you are able to see near the trachea are the spinous processes, which are the bony projections of the posterior part of the vertebra. Below the trachea is, as we know, the aortic arch or the aortic knob. Below it, the structure which you see is the pulmonary artery. Below it should be present the left hilum. Also revise the two angles which should be present in the normal chest X-ray. Number one being the costophrenic angle, and number two the cardiophrenic angle. And as we know that below this is the line of diaphragm, and towards the right side below the diaphragm should be present the shadow of liver, and towards the left side there should be the gastric bubble below the left hemidiaphragm. After that we will try to determine the atriums and ventricles of the heart. Now starting off with the left ventricle, above it will be the left atrium, opposite side right atrium, below it corresponding to the vertebral column there will be right ventricle, and below them there will be the para aortic line. And also on the right side there will be the right hilum once again. Also don't forget that these numbers which we have wrote in yellow are the posterior ribs. As I told that we can see 10 of them, so they are the posterior ribs. And remember the anterior ribs we can only see 9 of them. Let me write them in blue so that you will get a better idea that which are the posterior ribs and which are the anterior ribs. And here is number 9, 8, 7, 6, 5, 4, third, second and the first one. Also on both the sides we will be able to see the shadow of scapula. This will be the right scapula, and the left scapula respectively. Above it is, as we know, the clavicle. And also remember about the right hemidiaphragm and the left hemidiaphragm. And that's it. We have discussed almost everything about the normal chest X-ray. Don't forget to like, share and comment your ideas below the video. Thank you guys. Goodbye.